feedback. I've had some good through emails, but I'm just wondering, I want to open up the floor if anyone wants. And she'd missed a few of her consultant reviews. And she was struggling at home on increasing doses of painkillers. And the technique that we learned the other month on chronic pain that Freddie kindly shared with us, I ran that technique with her. And it was quite straightforward to do over the telephone. We managed to do it quite successfully. And it's easy to report back to say that, you know, she was quite happy with the technique. In the last few weeks, we'd actually managed to reduce her dose of analgesia, not completely down to 0, but at least by 50%. And that's just one example of a few of the patients that I've been able to deal with over the last couple of weeks. Some of you have written to me, giving your reports to say that they've had very similar technique success stories. And the reason I mention that is I know some of you have been a little bit reluctant, a little bit maybe nervous to try these techniques on your patients and clients. And one of the things piece of advice that I often give to my students is dare to fail. You know, there's no harm in the techniques that we're teaching you. There's no harm that's going to come to the patients that you're seeing by the things that we're sharing with you. And often what it is anxiety on the therapist's perspective, not wanting to try it with the fear of failure, perhaps. And I just want to throw that out at you and just maybe challenge yourselves a little bit. And a lot of you have been joining us for the last few months, and the techniques that we're sharing with you have got a very similar theme to them. And there's nothing stopping you from actually going out there and trying it on your friends and your family. And I do encourage you to do that. And on that, I just want to move on to today's topic of addictions, because we've got a lot to cover in the next hour. So I'm going to hand this over to Freddie now. So take it away, Freddie.
Hey, thanks, Naveen. Well, the topic of addictions is pretty vast, and I have my thinking on it. But as you know, as I say to everybody, a lot of this is my opinion, but it is an opinion based on working with over 30,000 clients as a hypnotherapist and seeing the results that's happening. I mean, I'll throw it back to Naveed in a while about the actual clinical explanation of what a physical addiction is. But my thinking on it is this, and the conscious part of our being, it's a strange thing to say, but it makes stuff up. And what I mean by that is it makes stuff up to justify our behavior, because we do foolish things as human beings. You know, let's just take one so-called addiction, smoking. When you think about smoking, there's very few more foolish things that human beings do than smoke cigarettes. One of the things I say to my smokers is that if someone came to your door tonight and knocked on your door and said, I've got something for you, it's going to cost you £40,000 over the next 10 years. You won't enjoy it very much. And on top of that, it's going to make you really ill. How many would you like? You know, when you put it to people like that, they realize how ludicrous it is. And the excuses that people make. I smoke because I'm bored. I smoke because it's something to do with my hands when I'm not doing anything else. And I kind of bat that back to my clients in as much as saying, well, if your 10-year-old son said to you, Dad, I'm bored, you wouldn't say, well, have a packet of cigarettes. We say these things to ourselves all the time. And my feeling is, if you think about the addictions that are around now that weren't around maybe 20 years ago, things like sugar addiction, shopping addiction, chocolate addiction, the moment that we add that label to a problem, it gives us as human beings a bigger reason to hold on to it. It's no longer, you're taking away the responsibility, if you like, by saying, if I'm addicted to this, it's not my fault. You know, it's not my fault that I ate so much sugar, I ate so much chocolate. I'm an addict. But the fact of the matter is, most of those things are psychological rather than a physical addiction. And I'll say, well, I will put it back to Naveed in a moment, because when I explain to my smoking addictions clients and again, you'll have to bear with me because I'm not a medical person. I say that the definition of an addiction is this: to continue to get any benefit from an addictive substance, whether that's heroin, whether it's morphine, whether it's any other kind of pain relief or antidepressant, to continue to get any continued benefit, you have to do one of two things. You have to increase the dose, or you have to shorten the time period between doses. And that's generally what kills people on heroin. They, at some point, those two things come together and they OD. But most of the people that we see as therapists, that I see as therapists anyway, that say I've got an alcohol addiction, or I've got a smoking addiction, or a sugar addiction, the fact of the matter is those people can function maybe all day at work without sugar, or without a cigarette, or without alcohol. And so it's more, in my mind, what we're dealing with in general is habitual behavior. And we've explained that in the past when we've spoken about how a habit is formed, how we as human beings have the ability to learn something that's complex and then learn it so well that it becomes an automatic function, something we do without thinking. And the moment that occurs, we no longer have conscious control over it. The moment it's someone's eating for comfort and it's become automatic, it would be as difficult for that person to change that behavior as it would be for you to say, well, I want you to forget how to speak or forget how to walk. It's the same with people who smoke or drink alcohol of an evening. And that's different to what I would consider to be an addiction. And there are, and the doctors here will explain it, I'm sure. There are, if you say to someone who's a proper alcoholic who is addicted to the alcohol, they can't just stop. It's not that they can say, okay, right, I'm walking away from this today. But you have to be weaned off it, because many of those people, if it was to happen, they would actually, you can die from doing that, from the DTs. But if you see the people that I see who see me for, you know, like a chocolate addiction or a sugar addiction, once we've run hypnosis on it, it's a binary thing. It's either on or it's off. It's not, they walk out there, they don't have to wean themselves off cigarettes over a period of months. They just, the need for that cigarette is gone. Because what we're actually dealing with is the underlying programming that's occurred in the learning of smoking. For most people I see who say, I've got an alcohol problem, it will be that they get home of an evening, they work all day, they get home of an evening at 6 o'clock, when they get in, they pour themselves a glass of wine. And then they'll drink maybe a bottle or a bottle and a half of wine. And then they'll get up in the morning and go to work all day. They'll come home. That's habitual way of drinking. The people who are alcoholics, they cannot function without alcohol in their bloodstream. And again, I'm going to back this back to the doctors here, because they can and happily, you know, say that I'm wrong on that. And it's the same for things like heroin. I see people with heroin addiction. As much as I love to think I can sit and say to them, look, we have an hour together, and they walk out the door and they quit and it's easy, it's painless. No chance. The most I can hope for, and it does happen, is they get into a state of mind where they go through the cluck, as they call it, and they get over it. But it takes a period of time. With all the other things that we label as addiction, even gambling addiction, it's a psychological rather than a physical addiction. I know that people will say, well, you get, you know, when you're gambling or when you're shopping, you're getting a dopamine rush, and so you can get addicted to that feeling. But it's not the same as a heroin addiction or alcohol or, you know, any of those other addictions. So when it comes to, for me and the people I see in general, for cigarettes or cocaine or cannabis or alcohol or shopping or chocolate addiction, all of those things have got a label of addiction on them. In my mind, they are not addictions. I know purely because I've seen 25,000 smokers in my time. And those people have come in smoking 20, 40, 60. I've seen people smoke 80 a day. And we have an hour together and they go out the door and they quit. And it's easy and it's painless. If that was a physical addiction, that would not be happening. And the kind of criteria when I say to my clients, I say, some people smoke, as I said, 80 a day, and I'll say to them, how long can you sleep for? And they'll say, I can sleep for 7 hours. Well, they're smoking in general. If someone's smoking 20 a day, they're smoking one every 35 minutes. But rarely does someone wake up every 35 minutes and have a cigarette. The other criteria is when you say to somebody who says, oh, I've got a tobacco or a nicotine addiction, the other criteria is that to continue to get something from an addictive substance, as I said earlier, you have to increase the dose or shorten the time period between doses. But if you ask anyone who smokes and you ask them how many they smoke, and then you ask them how long they've smoked that amount for, it'll be 10, 20, 30, 50 years, but the same amount every day. They've not had to increase the dose or shorten the time period between doses. So what I'm saying here is that most of the people who say I've got an addiction is more habitual than it is physical, or it's more psychological than physical. And that is why I believe with hypnosis, we can have a really big effect on it. But my kind of frustration is the fact that people are tagging addiction on the end of problems that a few years ago were not addictions. And so, and as I said, as human beings, and we're all the same, we find reasons for why we behave in a certain way. It's just the way our mind works, because you can't have that kind of vacuum. So the conscious mind will make up a reason for why we are behaving in the way we're behaving. And for a lot of our clients, it's truly about getting them to look at what they're doing and be honest about what they're doing and why they're doing it. And then, whatever kind of therapy you run on it, giving them the understanding that they can walk away from it. But that's why when people come to see me, the only criteria for me seeing a client is that they have got to a point where they want to change. If someone phones me up and says, like, my doctor says I've got to do this, I'll say, well, I won't see you. You know, my mother wants me to do this. My wife wants me to do this. My husband wants me to lose weight. I won't see them. There's a guy called Mike Mandel. He's a very well-known hypnotherapist in Toronto. And he calls it threshold. Is your client at threshold? And what he means by that is, are they absolutely ready to change? Because they have to come to that conclusion themselves. There's nothing that my mother used to say when I was saying something to her that, well, you're trying to teach someone who knows more about something than you do. She used to say, you were trying to teach your grandfather to suck eggs, which was a very strange saying, but I know what she meant. And I know I'm talking to more medically trained people than I am here. But what I'm saying to you is that client, doesn't matter how much you want it for them. It doesn't matter how much anyone else wants for them. It doesn't matter if their problem is killing them. None of those things are a good enough criteria. They have to be at threshold. They have to say, I want to change the way I live. I want to feel differently. And at that point, then for my mind, there's very little we cannot help our client change if they've come to if they're at threshold. So my thinking on this is that most of the addictions that are out there are psychological habitual behavior. In other words, it's an underlying program, and it's complex. Once, you know, as I say, for someone who's been smoking 20 cigarettes a day for 30 years, to just say stop would be like saying forget how to speak. They say, well, it's ludicrous. It's no longer something I think about. It's something I just do. But with hypnosis, and this is how I see it, it gives the operator, the hypnotist, the hypnotherapist, access to that underlying programming. So the client can make the changes. As I say to all my students and all the people I teach and the people I work with, I actually do nothing in my therapy room. I just create a platform or a situation where my client can get in touch with their own ability to change. And one of those things is before they came into my office, they didn't know that they could do it. And finding a lever, a big enough lever to change, is part of what I think is my job. And sometimes it's very easy because most of the clients will come in with the belief that they can't change. That's the number one belief. I've tried everything. I can't change. And if what they're doing is killing them, part of my intake form, if you want to call it that, it's not very big, my intake form, I ask them who are the most important people in their life. And the only reason I ask that question is because I want some levers. And if someone comes in and they tell me they've got a daughter or a son, I ask this question, if what they're doing is killing them. And most of the things, I mean, even to the point of, overeating can kill you eventually. And so I'll say, look, if you went to your doctor yesterday and he said, have another cigarette, you'll die, the chance of you quitting are minimal. And people nod because they've been to their doctor. They've been told that for years. And they nod because they know it to be true. But I ask this question. I say, but you have to ask the question. If you've been to your doctor yesterday and he said, have another cigarette and your son would die, I say, you quit, would you not? And every client goes, yes. And I say, have you got any doubt? They go, no. In that moment, in that very moment, you've knocked that belief out the window that I can't quit. I can continue to do it, but I can no longer believe that I can't quit. So that with things like smoking, for me, there are three beliefs that hold most people to what we would call an addiction. And those three beliefs are this: one, I can't quit. Two, I'm addicted. And three, it's doing something for me. And if your client walks out of your therapy room or your doctor's practice with any of those three beliefs intact, they're not going to change. That's my finding. That's my belief. And there are simple ways of breaking down those three beliefs. The first one is, as I say, find a big enough lever, a situation where they would quit. And you can generally find it. And you know my feelings on emotion now. I am going to use emotion to help my client change. Because if I can create an emotion, I can give a suggestion. They don't have to be hypnotized for me to give them a suggestion that's likely to stick. So the first thing I'm going to do, I'm going to ask those questions just as normal. Who are the most important people in your life? Why do you want to do this? A few questions, and then I'm going to wheel that out. So you don't believe you can quit. You don't believe that you can control your alcohol. Most of the people that come and see me with what they call an alcohol addiction, when really it's more of an alcohol habit. I drink a bottle of wine every night. I drink 6 cans of beer every night. That's different to waking up in the morning, having a glass of vodka, and then continue to drink vodka out of a brown paper bag throughout the day. But those people, when they come in, and the first thing they think I'm going to do is make them stop drinking altogether. They think that's what's going to happen. And I always say, before, it's up to you. We can knock this on the head completely, or you can get control over it. Which would you rather do? Because most people don't believe that I have that choice. They think it's either on or off. And I would say with certain things like smoking, yes, it is. But as I say, I'm not, I hardly drink any alcohol, but I'd hate someone to say I could never have another glass of wine ever. And so that's how I look at my clients. They're adults. They can make a choice, but they don't believe they have that choice. And I say, let's go with that choice first. To be able to go out with your friends at the weekend, have a glass of wine is different to feeling you have to have a glass of wine every evening when you get in. And for me, the difference between the criteria is this. The moment you say, I need a drink, rather than I want to drink, then you're in trouble. It doesn't matter what it is. It can be the same with relationships. The moment you feel you need someone in your life, you're in trouble. And so for me, these psychological hooks and it's words, the difference between wanting and needing, the difference between, fancying a glass of wine and needing a glass of wine. But most people believe that these things are set in stone. Because all the literature around it and all the media around it is that now I'm addicted. Imagine, just take the most common addiction, which is smoking. And there are 1.3 billion people on this planet who do it. Imagine that the government's decided to put up billboards and saying, look, smokers, you have a habit, not an addiction, walk away. That's not going to happen because there's too much money involved. But the truth of the matter is, that is what's going on. In 2006, I saw 5,000 smokers in 1 year, in groups of 200 people around the UK. I'd go down to Wales and I'd go to Llanelli on the Tuesday, Swansea on a Wednesday, Cardiff on the Thursday. I would see 600 plus smokers over 3 nights. And I was teaching people how to do it. And people were quitting in their hordes. I swear to you, people were quitting in their hordes. I could put an advert anywhere in this country and fill a room with 200 smokers. In fact, I came here to where I live close to Hull now, and there was 370 smokers booked on that one thing. I had to open up the next night. But what I'm saying is, and in 2006, what happened? The government put out a statement saying, so let's imagine you're the government and you can see a massive revenue being wiped off your revenue, because they get 10.5 billion pounds a year from smokers in this country. And people say, well, yeah, but they spend so much on the NHS. They do. They spend 1.75 billion pounds on treating smoke-related diseases. 1.75 billion pounds on treating smoke-related diseases in the UK. But even with my poor math, that still leaves 9 billion that they're getting from smokers. And so if you're the government and you can see, or you know, these lobbyists for tobacco, and you can see your revenue being wiped, how can you change that? So they all call in the best psychologists and they say, well, what happens when the government tell the people they can't do something? What happens? You're going to do it even more, because it's human nature. If someone says don't do something, they do it even more. So in 2006, they announced that they are going to ban smoking in pubs, restaurants, clubs all around the country. In 2007, July 2007. I promise you, and if you could see a graph, I put the same adverts out and overnight, those rooms dropped from 200 to 17. And then they flatlined because people were going, no, if they're telling us to do it, I'm not going to do it. In fact, in July 2007, and this is absolute truth, people who had stopped smoking with me started smoking again out of spite. That's how crazy we are as human beings, because they've been told they weren't allowed to do it. And I don't know, the doctors will probably have the facts on this. I doubt those numbers of smokers in this country have dropped at all. I don't think they've made any difference to them. And so what I'm saying to you is, all the time they're saying you're an addict, and then as human beings, we'll grasp that because it makes us feel better about our stupid or bad behavior. So it obviously is physical addictions. And we know that from the opiates that people are slaughtering people around the world. We know it from the drugs that are going around. But the general addiction label, I believe, is added to things that are more psychological, habitual behavior. And because of that, we can deal with it. I fully expect someone comes see me with a smoking habit. I don't care how long they've been smoking or how many they're smoking. If they want to quit when they walk into my office, an hour later, they're going to walk out without the need for a cigarette. I will put my house on that fact. Because if they really want to do it, they're going to do it. And it won't be hard and it won't be difficult. They don't go out and they don't have to go cold turkey on it. If someone comes in with a sugar addiction, I fully expect them to go out of my office after an hour free of that sugar addiction, because they're going to understand that they were never addicted in the first place. It's habitual and they don't need to be doing it. So these things that are major problems. But you've got to understand the propaganda that's out there by the companies that are selling that stuff. Every single person I know that's come to see me for weight loss, that's obese, who's seriously overweight, the one common denominator with every single weight loss client I've had, guess what it is? And I promise you, it's the same for everyone you'll see who's that seriously overweight. I'll tell you what it is. It's Diet Coca-Cola or Diet Pepsi. Every single client I've ever seen that's seriously overweight drinks that. And I've been saying for 25 years, if Coca-Cola could come up with a drink, a diet drink that worked, they'd be out of business in 6 months because everyone wouldn't need them. It's not in their interest to create a drink, but it is in their interest to create a drink that makes people believe that it's going to help them, because they can keep putting on weight and saying, well, I'm doing something. This has only got 1 calorie in it. They can justify what's going on. I'm making an effort. I'm drinking. I had one girl, and this is absolutely true. She came to see me. She was 22 stone, 32 years old, 22 stone. And I said, what is your daily food? She said, well, I wake up in the morning and I have a piece of fruit. And she said, for lunch, I have a chicken breast with the skin taken off and a bit of salad. And over the evening, so I have a meat and 2 veg. I only have a small portion. I said, I'm thinking to myself, well, she's either lying or she's in denial. So I said, what do you eat between? She said, I don't eat anything between. That's what I eat. So I just thought I'd ask the question. I said, how much? I said, what do you drink? She said, oh, I drink Diet Coke. It's only 1 calorie. I said, how much? 22 litres a week of Diet Coke. 22 litres a week. A bottle and a half of those big bottles every day. 22 litres of Diet Coke a week. And she was 22 stone. What I'm saying to you is, we are up against it. All of us are up against it. The marketing, the propaganda that keeps us doing things that we know are wrong for us. And as long as it's got a label on it which says I'm addicted, that makes us feel better as human beings, because our conscious mind will justify our stupid behavior and our bad behavior. Let's be honest. Some of us have it. I know I have, but it will justify it. I'm doing it because. So that's my take on addictions. But we can change. You have to find a big enough lever. There's a guy called Anthony Robbins. You'll probably all have heard him. It's that 6'8", mouthful of teeth American guy. Guru. The self-development guru guy. He's great. Don't get me wrong. But he said one thing that I stuck in my mind. He said this, and I believe it's true for all of us. He said, if you find a big enough why to, you can always find a how to. And what you're looking for in your clients is the lever, the why to do it. My son actually asks his clients to convince him of why they want to change. Convince me, he says. And that's, and people have to dig deep to do that. And they have to do it and have to be at threshold. But we can help people change. And even you can say that nicotine is an addictive substance, but the actual addiction part of that is so flimsy that it's not even worth thinking about. But you can actually say, you can state that. And for people like the tobacco companies, it's in their interest to pay people millions of pounds in compensation for the fact that they've been addicted to tobacco. It's in their interest to do that rather than say, look, this is not a physical addiction. Because all the time people believe they're addicted, they're going to continue to do it. So those 3 beliefs, no matter what your client comes in or your patient comes in with, the 3 beliefs that you have to crack for them to be able to walk away from it, whether it's smoking, whether it's cannabis, whether it's cocaine, whether it's painkillers, whether it's alcohol, is the first one, I can't quit. The second one, I'm addicted. And the third one, it's doing something for me. It helps me relax. It's something to do when I'm bored. It's social. They will find reasons. And if you can't undermine those reasons, they're not going to move off their addiction, because we as human beings will hang on to dear life for what we're doing if we can justify why we're doing it. So, Naveed, could you just explain what the medical kind of explanation of what an actual physical addiction is?
Well, while you were talking, I looked up the DSM-4 definition of addiction, and what it actually states is when an individual persists in the use of alcohol or other drugs despite problems related to the use of that substance, then substance dependence may be diagnosed. Compulsive and repetitive use may result in the tolerance to the effect of the drug and withdrawal symptoms when use is reduced or stopped. That's the definition technically. However, as you've said, Freddie, we know that sometimes there are no physical dependency component, and there are lots of addictions out there that actually don't fit that criteria.
Right. Well, when I let's take my smoking cessation process, if you like. I do this, and I'd like you all to take part in this, all right? This is how I get into it. I've spoken about the addiction part of it, and I've spoken about how most people who smoke sleep for 7 or 8 hours. They don't have a cigarette, don't wake up every 30 minutes to have a cigarette. Most people who smoke cigarettes have smoked the same amount for 20 or 30 or 40 years. They haven't had to increase the dose. And the other thing about smoking and alcohol, when you're talking about people who are drinking a bottle of wine a night, or whatever it might be, we make a decision on how many we're going to smoke, or how much we're going to drink, or whether it's cannabis or cocaine, or whether it's cigarettes, whether it's alcohol. We make a decision on how much we're going to smoke based on one of 2 criteria: finance and social acceptability. Most of the women that come to see me to quit smoking will be smoking 10 or 15 cigarettes a day, especially if they're working in office type environments. And they'll smoke that amount because at that amount, their clothes and their hair don't smell too bad. If you're smoking 40 or 50 cigarettes a day, your clothes and your hair will reek of smoke. And for most people in those situations, especially women, it's socially unacceptable to reek of cigarette smoke. So they'll settle for what is socially acceptable. Other people smoke 20 a day because that's what they can afford. If you're smoking 80 a day, like that man I saw a few weeks ago, that's about 13 or 14,000 pounds a year on cigarettes. And when you ask the question to someone who smokes, I say, just answer this for me. How many times a day do you go, I enjoyed that? And the answer will be no more than 4 or 5, even if they're smoking 80. And to spend 14 or 15,000 pounds a year on something you're not enjoying, for most people is financially unacceptable. So we'll settle for what is financially or socially acceptable with things like wine, cigarettes, cocaine, and cannabis. With an addictive substance like heroin, you do not have the luxury of that choice. People don't say I have this much heroin because I can afford it. They'll steal from their families. They'll prostitute themselves. They'll do anything to get the money. People don't say this much heroin because it's socially acceptable. They'll lay in some public toilet doing it. But smokers, people who do cocaine and cannabis, will settle for what they can afford or what is socially acceptable. And I say to my clients, you can see a difference, can you not? And people nod because they know it to be true. That's how I break down that argument about nicotine being an addictive substance. And then I say this. I want you all to do this. We'll have a go at this. Let's have a go. I want you to, I say people ask what hypnosis is, and people have different ideas. It's sleep, it's mind control, it's relaxation, all kinds of stuff. I used to say it was a natural phenomena. What I actually believe now is that it's a natural ability that we all have that we just don't know how to get access. But if we can access it, we can change the way we think, change the way we feel, even change our body shape. But above and beyond that, it's the ability to concentrate and use your imagination. Because when there's a battle between what you want and what you imagine is most likely to happen. When I used to run these groups for smokers all around the country, where I had 200 people in a room, the way I described this about your imagination being stronger than your will, I used to say this. I say, if I laid a scaffold board across the floor from one end of this room to the other, 40 feet long, 18 inches wide, 40 foot long. And I say, I put a bag with 50,000 pounds on the end of that plank. I said, all you have to do is walk across that plank and pick that money up, it's yours. I say, how many of you would do it? And 200 hands would go up. I say, if I take that board and I put it between two buildings 90 feet high, how many of you would get to the bag of money? And no hands go up. And I say, well, what's the difference? It's the same plank. It's the same distance. It's the same amount of money. All that's changed is your imagination. The moment you step on that board, even if it crosses your mind for a moment, you might fall, you are going to fall. Your body will carry that out. So that's what I say. So it's about concentration, using your imagination. I'm going to show you what I mean by this. I'm not going to take you into a trance. I'm going to show you how powerful your mind is. But I want you all to do this. Place your hands together like this. Clasp your hands together. And pull your hands up where you can see them and squeeze them tightly together. And at the same time as squeezing them tightly together, pull your index fingers an inch apart. Now look at the gap between those fingers, and as you look at the gap and listen to my voice, you're going to feel them pulling together. Imagine they're magnets and they're pulling together. In a moment, they will touch, and when they touch, your eyes will close. Get ready. As those fingers touch, close your eyes. Now think about the person you love most on this planet. It might be your pet, it might be your family, but think about the people you love. Feel that love now. As you feel that love, as you see those faces, every limitation disappears and those hands are locking tighter and tighter together. Imagine they're super glued, they're bolted together, they're stuck. Imagine they're carved out of a single piece of wood, and when you realize they're stuck, you can try and pull them apart. Find they stick even tighter now. Imagine there's nothing you can do about that. Harder you try and get them unstuck, the tighter they're going to stick. In a moment, I'm going to count to 3. Your hands will come unstuck, your eyes will open, you'll feel incredible. Be ready for the next learning. 1, feeling wonderful. 2, to achieve what you want to achieve from this class tonight, do it brilliantly. 3, hands coming unstuck, eyes opening, feeling absolutely wonderful. And so I will demonstrate that with my client, and then I'll say this. The government understand, the government, tobacco companies, the drug people, and the big farmers as well, big farming companies, they understand this piece of psychology, and they know all the time they can convince you that you're addicted, and if you quit, you're going to suffer or put on weight. Even if it crosses your mind for a moment that it might happen, it does. I say to my clients, they say, what about the withdrawal symptoms? And I say, what's it going to be? Some people will say, well, my mum quit smoking, she put on weight, and I really don't want to put on weight. Or my dad quit smoking and he got aggravated with everybody. Or my sister quit and she got depressed. Or my brother quit, he got lethargic. That's already 4 or 5 different kinds of withdrawal symptoms from the same drug. With an addictive substance like heroin, the withdrawal symptoms are the same for everyone, whether you're in Hong Kong, Hornsey, London, or New York, and doctors and nurses can timetable it. But with smoking, with cannabis, with cocaine, with alcohol, the withdrawal symptoms will be whatever that person imagines it's going to be. But most of those people will know someone who one day said, I'm not having any more to drink, not having any more alcohol, and walked away from it. Or I'm not having any more cigarettes, and binned them and walked away. And didn't suffer and didn't put on weight or didn't get aggravated. They just changed their mind. And if your client can understand that they have the capability of just changing your mind about something, I want you all to think of something. that you think you cannot stop doing right now. Something, I don't care what it is. It's eating chocolates, eating too much, smoking, whatever it is right now. I want you to think about it. Imagine that you could just change your mind about that. And imagine that's happened now. And imagine it's happened and there's nothing you can do about that. Imagine that. Imagine that's just happened. So I snap my fingers, that need is gone. And there's nothing you can do about that now. Think about how you're going to feel in a week from now, or a month from now, or 6 months from now, having been taken back control of that. And then think about it and feel into it. Feel how it's going to feel. And then ask the question, how much fun is that to have got back control of my life? How much fun can I make that? And how important is it for me to do that? Because if that you're feeling into that now, and now you know how much fun that's going to be, how much joy is it going to be to put your knife and fork down with some food on your plate and say, I've had enough? How much joy is that going to be? To have a glass of wine and for the second glass of wine say no thanks. How much fun is that going to be? How much fun is it creating the body and the life you want? Taking back control, because you've always had it. It's just that people have convinced you otherwise. Of course you can quit smoking. If your child's life depended upon it, you'd quit right now. Of course you can lose weight if that's what you want to do. The question is only, how badly do I want to make that change? We have much more control than what we think we have. Now, I've been saying to my clients for a while now, you're not your body. You're not your name. That was given to you. You're not even your thoughts. Because you do not know what you were thinking this time yesterday. And you do not know what you're going to be thinking 3 thoughts from now. Yet we think we have control over our thoughts. Of course we don't. They bubble up. And once you understand that, if you can get your clients to understand that whatever they think they are, they're miles more than that. And we can say, today's the day. And then commit to making a change. And if it's habitual, if you know how to use hypnosis, if you know someone who doesn't use hypnosis, then they can run what I train people to do is the parts negotiation, which is changing the underlying programming. Because that's all it is. It's a piece of programming. It's that enables us to function the way we function as human beings. It makes us the most incredible creation in the known universe. Think about the complex things you do: driving, walking, reading, writing, swimming, riding a bicycle. You think of the complex things you do, playing a musical instrument, all the things that you doctors have learned, the amount of knowledge you've got in your mind is immense. And it enables us to function like that. But every now and again, we learn something to the point where it becomes automatic that then becomes redundant. Because what might have seemed important at 30 seems ludicrous. What might have seemed important when you're at school and told to finish your plate of food, when you're 30, that's no longer true. And yet that piece of programming is now set. But hypnosis gives us access to that program. And it can change in an instant. And some of you will have changed tonight, because you'll understand that some of the behaviors you're carrying out, some of the things you consider to be unchangeable, were always changeable. They just didn't know you had the ability. So I know you might be getting a bit off, I don't know, getting off track here, but I'm saying to you that most of the labels of addiction are psychological, habitual behaviors. They're not physical. But if you, like with you, those of you who had your fingers stuck a moment ago, if your mind is so convinced of something, your body will carry it out. If you think you're going to put on weight, if you stop doing something, the chances are you'll put on weight. Nobody eats cigarettes. So why would someone, when they quit smoking, have to eat more? It's not like you're eating your cigarettes and you're hungry because you're not eating your cigarettes anymore. Yet people, it's because it's a belief. Why would they make you anxious? The fact of the matter is this. When you smoke cigarettes, the carbon dioxide in cigarette smoke clings to your blood cells 200 times easier than oxygen. And most of the oxygen that you take in goes to work your brain. So for your brain to get the oxygen it needs when you're smoking, your heart has to work a lot harder. That's why I see people in their 30s, 40s and 50s who are lucky enough, not got as nasty as cancer from their cigarettes, are generally suffering from heart problems, blood pressure problems, or those kind of things. The opposite actually happens. Instead of relaxing you, it actually speeds your heart up. It actually makes your heart work harder. Yet we're told, because not in your day, I know, but back in my day, you know, you're never alone with a strand. Mark might remember that advert. You're never alone with a strand. When this was years ago, I saw a guy in Portsmouth in one of my groups of smoking. The guy was there. He had one leg. He'd had a leg removed from thrombosis from smoking. And he was thinking about suing the Admiralty. Because when he went in the Second World War, and probably before that, First World War, Second World War, when those kids were sent off to war with their pack, their uniform, and all their stuff, there were 200 cigarettes, senior service cigarettes. Every kid had 200 senior service in their pack. These kids were away from home. They were scared witless. And all the marketing was that cigarettes relax you. They make you. And the other one, you're never alone with a strand. Imagine some kid in France, scared witless, without his mum, and the advertising is you're never alone. Makes you feel like you're not alone. You think about that. This guy was going to sue the Admiralty because he started smoking because the pack was in his, when he went into the Navy, that's what he had. And so all of this is going on all the time around us. We have to be aware of it. And we have to be aware that when it comes to marketing, exactly what I was saying to you earlier about creating an emotion and giving a suggestion. It's no more complex than that. Let me show you something. Let me just, I haven't got everyone on my screen, but Gillian, is it Gillian Birtwell? All right, let's just try something, all right? Just to show you how we are as human beings and how marketing and advertising, especially the addiction word, works. I want you, Gillian, just for a moment. Who are the most important people in your life?
My mother.
Your mother, okay. Think about your mother now. Think about the love you feel for her and she feels for you. Feel that love right now. And as you do that, notice that you're stuck in your chair. Imagine there's nothing you can do about that, Gillian. And when you realize there's nothing you can do about it, I want you to try and stand up and find you cannot. And I do not want you to pretend. Feel that love you feel for your mum. Try and get out of that chair. I don't want you to pretend. Try as hard as you can to get out of that chair. Find you stuck even tighter. Try even harder. Come on. You're a strong woman. You've been standing up your whole life. Why can't you get out of your chair? Put your hands on the chair and try and push yourself out and find you're stuck even tighter. Now, something even strange has happened. Your hands are now stuck to the chair. Try and pull your hands off the chair. Find you can't get your arms off the chair. Try. Are you hypnotized? Are you in a trance? Why can't you get up? Why can't you move your hands? I click my fingers. Everything goes back to normal. And of course you can stand up. And of course you can move your hands. I know it's ridiculous, but you've got to understand this is happening to us all the time with marketing. They are spiking an emotion. You imagine you're in Manchester. I don't know why I said Manchester, but it's raining hard and it's miserable. And you're sitting at home and it's raining hard and miserable outside. Sun on the TV, a guy comes on riding on a white stallion, dressed as an Arab, and he jumps off his horse with a box of black magic chocolates and whatever it might be. And all of a sudden your emotions have changed because you're looking at this incredible scene. Next day you're walking through Sainsbury's and you've got black magic. I'll pick them up. You don't even realize that you've even had that experience by watching the advert. But it's happening to us all the time. And we've got to be aware of it and realize that most of our limitations are placed on us and they're suggested to us. I thought what time it is, or we're getting out of time. So look, I don't know if I've helped you at all here, but I want you to think about this for yourself and for your clients and your patients. And maybe, because you'll know, if they're functioning through the day and they're doing something in the evening, or they say, I've got a cocaine addiction. And when do you do that? Well, on Friday nights, I go out with my friends, have a few lines of coke, blah, blah, blah. That's not a physical addiction if they can function without it. And then maybe suggest to them that they have more control over this than they want. And it's about making a decision, finding a big enough why, a big enough lever to move them off it, and then finding how, then they will find how to do it. All of you here are all carers. All of you are therapists of some kind. All of you have the ability to help that client change. They've just got to want to do it, and you've got to explain to them that this has only ever been a belief or a suggestion that's been given to them in an emotional state. So anyway, I'm going to hand back to Naveed, and I'm sure he's going to ask if anyone's got any questions, or we've got kind of 5 minutes. If you've got anything else to say, Naveed, because I get passionate about this because I see so many people's lives destroyed by it.
Thank you so much, Freddie. That's incredibly insightful. If anyone's got any questions, Helen has asked a question: is nicotine isn't addictive?
Nicotine is an addictive substance, but the actual addictive part of that is so flimsy. It's not like a heroin addiction. It's, you could say there's an addictive element to it, but honestly, I can promise you, because I've seen it so many times, Sean Naveed's seen it and Mark's seen it as well. People, when they make that decision, it's not hard. It doesn't matter whether they're smoking 80 or 60 or 10. In fact, I always say, I think it's harder for someone who's smoking 5 a day than someone smoking 60 a day. Because at 60 a day, you are experiencing pain from it and it's killing you. At 5 a day, part of our brain goes, it's just 5. It's only 5. I think it's harder. But what I'm saying is, no, I'm not going to say it's not an addictive. It is an addictive substance, but the actual addiction part of it is so flimsy that it's hardly even worth speaking about. Hope that answers that question.
And you're absolutely right, Freddie. I mean, I've seen it so many times, and I'm sure all of you have seen it, where people have been smoking 10, 20, 30, 40 a day for years and years and years, and they get that scare. They go into the hospital, they have a bit of chest pain, and the doctors have told them, if you carry on smoking, you're going to die. And instantly overnight, they'll stop. They'll wake up the next morning and there's no craving, there's no withdrawal, there's no nothing. People can stop just like that. Like you say, if you give them a big enough why. Amanda said, young people don't see advertising, they've got social media as well. Absolutely, social media is a huge influence nowadays. You don't see it on TV, but it's peer pressure, and it's absolutely social media interaction.
I mean, what if they really wanted to help kids not stop, but stop from starting smoking, they could put on these programs that the kids watch. I don't know what they watch, maybe like EastEnders and whatever, I don't know. But they could put one nerdy teenage kid in there and make him the smoker. And they won't want to be related to that image. They could do that. These major TV companies could do that. One of the guys that trained with me as a hypnotherapist, his company is called Rockstar, and they created Fortnite, all these kind of bad video games. He's earned millions. He's in his 30s. He's kind of retired. He's made so much money. Someone bought him out. But all of those GTA, Grand Theft Auto, all the ones that no mum wants their kids to use, he created all those things, right? And he did some training with me. I said, look, there's an opportunity here for you to create some more games where these kids, without them even knowing, because they are hypnotized when they're watching these games and they're in those games, he could put something in there that would help those kids be the best they can be. Why would you not do that with that much influence? But they're doing that, all right? So he said, you know, just when I was out, you dragged me back in. He thought he had escaped it. But there's an opportunity for people. And it's the same with TV. It's the same at radio. They could be using these things. If they only have to make, because kids are influenced. If they make the nerdy character, the teenager that nobody particularly likes, the smoker, the one who's doing the smoking weed, the one who's drinking alcohol, they make that kid the nerdy one that nobody wants to be kind of related to, they could stop kids starting. Why don't they do it? I have no idea. But anyway, that's what could happen.
Freddie, we've got a couple of questions on some hard drug examples. So could you give us some examples of cocaine or methadone addictions and how your strategy was with them?
Well, there's a few things you have to do. As I said, one, they have to recognize that they're at threshold. They really want to quit. They've got to understand that they are going to go through some withdrawal and it might be painful. But most people who are on heroin have been through it once. They know they can do it. It might be painful, but they know they can do it. And then as hypnotists, we can give them things like an anchor for getting them through, anchor for determination, and we have the arrow to work on any of the discomfort and pain from their withdrawal. So we have tools to help them get through it, but their body still has to get through that, get that drug out their body in a kind of timely fashion. If it's, as I said, with alcohol, if someone's drinking alcohol all the time and they just stop, there is a percentage of those people that will die. So if you're working with someone who's a proper alcoholic, then you have to explain this is going to be a process and you're going to give them the strength and understanding to get through it. But they have to understand they can get through it. I saw a girl for heroin addiction once. She was 32 years old and it was still kind of cool for her, even though she really wanted to. She'd done everything, I promise you. She sold everything, including her own body, to get this drug. And she was ready, she was at threshold, but she was still in the same group of people. And one of the hard things for people in those situations is understanding they have to change their environment. Because it's so difficult. But I just said this to her. I said, look, at 32, you know, you still look kind of reasonable. I said, go out into the future. And you're 42 and you're still taking that drug. Have a look at yourself walking down a road. That was not a pretty sight. Because she knew, you know, and that was enough for her to make the change and get over it. Because sometimes you just have to point out what the next step is in this thing. But you'll find it. All of you within you you'll find the levers. If you listen, they'll give you the levers. But they have to, like the answer to that question, yes, you can deal with hard drugs. The person has to want to quit and they have to understand that it's going to be a process of withdrawal. But you can give them the tools and the support to get through it.
We've still got quite a few questions, but I'm very conscious that we've run out of time, unfortunately. 8 o'clock. So I want to thank you all for attending. And I want to say a big thank you to Freddie for hosting this event. Next month's event, first Thursday of the month, is going to be on body and weight image, body dysmorphism, and weight problems. So I really hope that you can join us for that event next month. And I wish you all a very good evening and thank you very much again.